Today we will learn about what is mesothelioma. Mesothelioma is a type of cancer that develops from the thin layer of tissue that cover many of the internal organs known as the mesothelium. The area most commonly affected is the lining of the lungs and chest wall, less commonly the lining of the abdomen, and rarely the sac surrounding the heart or the sac surrounding the testes may be affected. Signs and symptoms of mesothelioma may include shortness of breath due to fluid around the lung, a swollen abdomen, chest wall pain, cough, feeling tired, and weight loss. These symptoms typically come on slowly. More than 80% of mesothelioma cases are caused by exposure to asbestos. The greater the exposure, the greater the risk. As of 2013, about 125 million people worldwide have been exposed to asbestos at work. High rate of disease occur in people who mine asbestos, produce products from asbestos, work with asbestos products, living with asbestos workers, or work in building containing asbestos. Asbestos exposure and the onset of cancer are generally separated by about 40 years. Washing and clothing of someone who worked with asbestos also increases the risk. Other Other risk factors included the genetics and infection with the simian virus. Simian virus 40. The diagnosis may be suspected basis on chest X-ray and CT scan findings and is confirmed by either examining fluid produced by the cancer or by a tissue biopsy of the cancer. Prevention focus on reducing exposure to asbestos. Treatment often includes surgery, radiation therapy, and chemotherapy. A, pro- a procedure known as pleuro disease, which involves using substances such as talc to scar together the pleura, may be used to prevent more fluid from building up around the lungs. Chemotherapy often includes the medications cisplatin and pemetrexed. The percentage of people that survived 5 years following diagnosis is on average 8% in the United States. In 2015, about 60,800 people had mesothelioma and 32,000 died from the higher in Australia and United Kingdom and lower in Japan. It occurs in about 3,000 people per year in the United States. It occurs more often in males than females. Rate of disease have increased since the 1950 century. Diagnosis typically occurs after the age of 55 and most deaths occur around 70-year-old. The disease was rare before the commercial use of asbestos. Signs and symptoms. Lungs. Symptoms or signs of mesothelioma may not appear until 20 to 50 years or more after exposure to asbestos. Shortness of breath, cough, and pain in the chest due to an accumulation of fluid in the pleural space. Pleural effusion are often symptoms of pleural mesothelioma. Mesothelioma that affects the pleura can cause these signs and symptoms: chest wall pain, pleural effusion or fluid surrounding the lungs, shortness of breath, which could be due to collapsed lung or the pleural effusion, fatigue or anemia, wheezing, hoarseness or a cough, blood in the sputum fluid, coughed, coughed up hemoptysis. In severe causes, the person may have many tumor masses. The individual may develop a pneumothorax or collapse of the lung. The disease may mm, mm, the disease may metastasize or spread to other part of the body. Abdomen. The most common symptoms of peritoneal mesothelioma are abdominal swelling and pain due to ascites, a buildup of fluid in the abdominal cavity. Other features may include weight loss, fever, night sweats, poor appetite, vomiting, cons- constipation, and umbilical hernia. If the cancer has spread beyond the mesothelium to other part of the body, symptoms may include pain, trouble swallowing, or swelling of the neck or face. These symptoms may be caused by mesothelioma or by other less serious conditions. Tumor that affect an abdominal cavity often do not cause symptoms until they are at a late stage. Symptoms include abdominal pain, ascites, or an abnormal buildup of fluid in the abdomen, a mass in the abdomen, problems with bowel function, weight loss. Next, heart. Pericardial mesothelioma is not well characterized, but observed causes have include cardiac symptoms, specifically constrictive pericarditis, heart failure, pulmonary embolism, and cardiac tremor. They have also included non-specific symptoms including substernal chest pain, orthopnea, shortness of breath when lying flat. The cough. These symptoms are caused by the tumor encasing or infiltrating the heart and stage. In severe cases of the disease, the following signs and symptoms may be present: clots in the veins, which may cause thrombophlebitis, disseminated intravascular coagulation, are dissolved, causing severe bleeding in may body organs, jaundice or yellowing of the eyes and skin, low blood sugar, pleural effusion, pulmonary embolism, or blood clots in the arteries of the lungs, severe ascites. If a mesothelioma forms uh, m- metastases, these most commonly involve the liver, adrenal gland, kidney, or other lungs. causes. Working with asbestos in the most common risk factor of mesothelioma. However, mesothelioma has been reported in some individual without any known exposure of asbestos. Tentative, tentative evidence also raises concern about carbon nanotubes. Asbestos. The, the incidence of mesothelioma has been found to the higher in population living near naturally occurring asbestos. People can be exposed to naturally occurring asbestos in areas where mining or road construction is occurring, or when the asbestos containing rock is naturally weathered. Another common route of exposure is through asbestos containing soil, um, which is used to whitewash, plaster, and roof houses in Greece. In central Cappadocia, Turkey, mesothelioma was causing 50% of the deaths in three small villages, Tuskoi, Carrion, and Sarihdir. Initially, this was attributed to enrionite environmental exposure to asbestos has caused mesothelioma in places other than Turkey, including Corsica, Greece, Cyprus, China, and California. In the northern Greek mountain town of uh, Metsovo, this exposure had resulted in mesothelioma, including around 300 times more than expected in asbestos-free population, and was association with very frequent pleural mm, calcification known as metsolenx. The document presence of asbestos fibers in water supplies and food products has fostered concerns about the possible impact of long-term and as yet unknown exposure of the general population to these fibers. Exposure to talc is also a risk factor for mesothelioma. Exposure can affect those who live near talc mines, work in talc mines, or work in talc mills.